Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness. And today we're going to be talking about that mental health and wellness piece. So if that sounds like something that you're into, make sure you like this video and subscribe. Share it with anyone you know is struggling with either an autoimmune condition or just trying to find answers to why they feel a certain way. Sharing really helps us get in front of more eyeballs. That really helps us with the algorithm. And I know that our rheumatology and doctor appointments are super fast, and there's not always enough time to get all of our questions answered and talk about all the things that affect our health. And here at Connected Rheumatology, we aim to help provide some of that guidance. Today we're going to be talking about an issue I know comes up a lot, and that is, why do doctors keep asking if I'm depressed? So let's get into it. All right, so I'm going to paint a picture, and if any of these elements or of this scenario rings true with you, then just know that I'm sending you a lot of compassion and that you aren't alone. So let's say you start having a bunch of weird, seemingly disconnected random symptoms. You are doing your due diligence and you're writing your symptoms down and you're seeing your doctor and you're getting some tests done and you're getting referrals to different specialists, maybe a rheumatologist, but no one can really give you any answers. Nobody is able to put it all together. Your symptoms they're like still weird. You can't really explain them. They don't seem to be related to anything. And you are just going in circles trying to find answers. And as more doctors you see and time goes on, you start to get the impression that you aren't really being paid attention to. And then this one question keeps popping up with the different doctors that you see, and it is, do you think you're depressed? Now, I have been on the other end of that conversation, and in my experience, that question can elicit two different reactions. One is, well, I should say both are angry, but one thought that often comes to mind by patients is, here we go again, they aren't listening to me, and they think it's all in my head. The other reaction is, of course I'm depressed because I feel like crud and nobody is listening to me. Both reactions are perfectly understandable and legitimate. But I wanted to just bring this up and really start a conversation about this particular question that I know can be so difficult to hear, and it's certainly difficult also on the doctor's end to really be able to communicate what we're really trying to say. And I'm going to get into that a little bit more. I want to offer up two concepts to consider. And the first concept is the idea that our emotions can lead to physiologic changes within our body. And there are certain scenarios where we are all very aware and comfortable with this idea. Think about fear. When you are afraid of something, we all know that can cause your heart to race, your palms to sweat. These are real changes that are happening in your body and that you feel. I mean, just talking about it, actually, I'm starting to get sweaty palms. When you're sad, we know that people can get brain fog, have trouble concentrating. We know it can change your appetite. Some people will have a higher appetite when they're sad, and some people will have a lower appetite. And if you can't quite think of a scenario where this has happened to you, just think of the last time you were heartbroken. We all know panic attacks can cause someone to have chest pain, racing heart, trouble breathing. If you're lucky enough to never have had a panic attack, let me just say they are very real. And these are very real changes that are happening in the body in that moment. So we're all comfortable with those ideas, but those ideas are kind of acute, right? They're in the moment. I'm afraid right now. I'm sad right now. I'm having a panic attack right now. But when we think about long-term symptoms, it can be the same, but we just sometimes have a harder time wrapping our head around that. Chronic emotional states can lead to ongoing physiologic changes in the body as well. Things like headaches, migraines, stomach pain, pelvic pain, joint pain, fatigue, brain fog. These are all symptoms that can stem from a chronic emotional state. And it can be tough to identify because the emotional state can become our normal. It's not like I'm afraid right now and you can be like, I wasn't afraid a minute ago and now I'm afraid. You know, when we have an emotional state that's been going on for months, maybe even years, it can be sometimes hard to see. The other concept is this idea that our treatments, our therapies, are now starting to focus on treating both the central nervous system as well as the peripheral. So what I'm saying is that our treatments treat both the brain and the body. And this has come about based on research and an acknowledgement that, first of all, the brain is a part of the body and should never have really been separated. And to truly get at successful treatment of some of these medically unexplained symptoms, you really have to go at it focused on both those areas. Focusing just on the stomach, for example, if you're having stomach pain, will only get someone so far. And new therapies are coming out that focus on the stomach and maybe the nervous system around the stomach, but also how that nervous system communicates with the brain. When we go back and look at some of our older medications that we were using for some of these symptoms, and we weren't really sure how or why they helped, but they seemed to help. Now when we go back and look, we say, oh, it actually was having an effect somewhere within the brain that was then helping with the symptom. And it's not all about medications by any means. Therapies that have been used by humans for hundreds of years do just this. Yes, I'm talking about meditation, yoga, walking in nature, hanging out with friends, having good social interaction, being creative, doing something in the creative arts. All of these things help both the brain and the body. You can't really separate the two when you're trying to address these symptoms. In general, I think the word depressed is overly used and isn't specific enough when we are trying to really get to why someone might have certain real symptoms in their body. And you know, when we think of someone depressed, we conjure up this image of kind of Eeyore, right? Like crying, blue all the time. And quite honestly, that's not the way a lot of us feel. And when we use the word depressed, we sometimes kind of shoot ourselves in the foot and get the conversation off to the wrong start. When really, we need to be more specific with what we're asking and with what we are feeling. That could be anger, it could be anxiousness and fear, it could be grief. Being more specific about what you or someone else might be feeling is really the first step to acknowledging that is something that's going on, and then we can investigate how or why or in which ways that emotional state might be affecting your physical symptoms. Now, I want to be clear. If you are having some sort of symptom, it is absolutely legitimate and reasonable to do testing to figure out if there is something within the body that's causing those symptoms. But at the same time, it's legitimate and reasonable to start investigating how your emotional state may be exacerbating those symptoms or originating those symptoms. They're both necessary to really provide a comprehensive 360-degree approach to getting you feeling better. So I would never suggest that someone comes into my clinic with joint pain or stomach pain or headaches and just immediately chalk it up to, well, you're just sad or you're just angry or whatever it is. Of course not. No. You do your testing, but it's so important, even if you were to find out you have whatever diagnosis, even if you're given a diagnosis of lupus or RA or whatever, it will only benefit you to also take the time to investigate your emotional state and how that may or may not be impacting your symptoms. So I have some questions that I've put together that you might want to consider thinking about and maybe bringing to your own doctor to try to kind of bridge this maybe divide that oftentimes that "are you depressed?" question can create. And so the first question is, I understand that my insert emotion could be contributing to my insert symptom. However, in an effort to make sure that we're not missing anything, are there any other tests or consults you would recommend I pursue? Another question to ask, what strategies would you recommend I start to look into to address this problem? And really be open to any and all strategies that they might bring to your attention. It might be stuff you hadn't thought about. And then the last question I recommend everyone always ask, whether you are given a firm diagnosis or whether you're not, and that is asking your doctor, have you seen cases like mine? Now, I always say in these videos that every person's individual, no case is the same, and that's true. But there are certain common things that we see with patients with certain conditions or on certain medications or whatnot. And a doctor's experience with cases similar to yours is only going to improve your chances of getting better and getting you the care that you need. And there is no reason why you shouldn't be able to ask your doctor if they've seen similar cases. And if the answer is honestly not really, it's perfectly okay to go find a doctor who has seen cases similar to yours. A key point I hope this video conveys is that mental health is physical health, and physical health is mental health. They are the same. To really approach your symptoms in a comprehensive and caring way is to include that mental health component. We all, doctors included, need to expand our understanding of health and disease to make room for these concepts about the emotional state and how it may or may not be driving certain symptoms. And then incorporate that into our regular workup. We are all very familiar with, I'm going to the doctor for joint pain, so I'm going to get an x-ray and maybe I'll get some blood work. Well, we should also become used to and normalize the idea that if I'm going for joint pain, I'm going to get x-rays and blood work, and I'm also going to be asked to start thinking about my life, my emotional state, my stress level. This should just be our normal workup for any of these symptoms. All right, so that was it. Those are my takes on why you might be getting that question of why I keep getting asked why I'm depressed when I go to see the doctor for my symptoms. I hope you found this helpful. You know, my goal here is really just to add some context to that question, get you thinking about your own body, your own symptoms, and get you maybe putting together some conversation starters or some questions that you can then ask your own doctor. Like we say here at Connected Rheumatology, it is all connected, and I really believe that to leave this piece of the puzzle out is to really provide complete care. So if you like this video, hit like, please subscribe, please share. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because it's all connected. Thank you. See you next time.